Hi, everybody. Hello from the Simulation Center. My name is Amy. You see we have our masks on, so we'll try and kind of indicate to you who's talking. This is Dr. Pedro Barbieri.
Hey, that's me. Nice to meet you guys.
And this is Amy. She is
Hi.
one of our techs at the Simulation Center. So thanks so much for watching our tour. We are going to take you guys through a couple of things today. We gave you that virtual tour so that you could see the whole space without us having to walk through it. But what we can do is we can show you some of our more exciting rooms. And we're going to finish up the tour. There's Conrad Dove. Say hi, Shiva Robotics. And so we're going to take you into our task training room. And I'm going to flip the camera around and show you around this room a little bit because we have some really amazing stuff in here. So as you saw in the tour, these are some of our high-tech, we call them simulators, but other people might call them toys. That's Harvey over there. So Harvey is a heart sound simulator. He can simulate all of these different heart sounds, which are all different things that cardiology doctors, heart doctors, would need to know in their training. And so this room is a space where all of our staff are welcome to come at any time and train on these different trainers. So this is something that they can train suturing on. So suturing is stitches, if anybody's ever had stitches before, hopefully not too many people, but they can practice how to do these sutures inside the body. So they call that laparoscopically. So these are the actual tools that they would use in a laparoscopic surgery. And we have those here for our people to train on at all times. I'm not sure, I haven't watched the rest of your camp today, so I don't know how questions are working, but if you want to hold questions to the end, that would be really fantastic. That way I can not have to monitor the chat because I am walking you guys around on my cell phone, so it is difficult to see the chat while I'm walking you around. This is one of our coolest toys. This is a robotic surgical trainer called the Da Vinci. And so sometimes surgery needs to be assisted with trainers and with robots. And so this would be in the room with the patient when they were having surgery. The surgeon would sit here and operate some arms that would be across the room. And they would be performing surgery on the patient by looking through these little lenses. So if you want to learn more, Google Da Vinci, not Leonardo. So what we're going to do is we're going to walk you down to our operating room, and Dr. Barbieri and I are going to give you a couple little demonstrations. Here we are, just like in the video. This is a control room over here where Amy, one of our techs, would sit during a simulation, and she would control all the vital signs of the patient and all the cameras. And the vital signs are heart rate, respiratory rate, so how fast or slow you're breathing, blood pressure, things like that. So Amy would control all of that during a simulation. And you can see we have quite a nice view up here. It's a beautiful day in our neighborhood. We're going to walk you down here past our inpatient room. Sim Man is waiting for his scenario tomorrow. So tomorrow, Sim Man is going to have a heart attack, and we are going to help him with this. We're going to help him get better. This is called a defibrillator. So if most of the time your heart is supposed to go bump, 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 bump. And if you're having a heart attack, sometimes your heart's going like this. And if it does that, we can attach these pads to your chest and we can shock your heart and go boom. And then your heart goes, oh, sorry, now I'll do the right thing. And it will start pumping properly, hopefully. So let's get down to business down here in the operating room. one of the cool things that we will pass on our way to the operating room is the anatomage table. And the anatomage, think anatomy and image. It's a virtual anatomy table, and it works very similar to an iPad or tablet, just a really large one. And it comes with some regular bodies on it. You can toggle on the skin and the soft tissue of the body. You can virtually dissect, and then you can get rid of part of the body. And then you can see inside, and then you can toggle that cut out part all the way through the rest of the skin. Now, why is that important? Well, that's important because sometimes it's really hard to see something inside of a patient, and typically what the physicians would see is this image. So they would see this, which is a CT or an MRI. You guys probably know it as an X-ray. So the physicians would see this black and white, but the anatomage helps us see it like this in 3 dimensions. And that's really important because sometimes something is really complex. So we had a patient who had a tumor in his face. When we put it on the anatomage, we were able to see other problems around that tumor, go at that tumor in a different way, and the man was actually able to come away with very little scarring on his face, and he got all better, which was great. Which the first way we were going to do it was going to leave a lot of scars on his face, and he was going to lose 1 or 2 teeth permanently. So the anatomage really helped because it allowed the doctors to visualize things. I saw in your last presentation, you guys were doing some 3D visualization, and that's exactly what this does, is it takes that 2D image that's black and white, and it gives you the opportunity to visualize it in 3 dimensions. So that's one of our amazing tools that we have here for the doctors and nurses and other staff to use to help us diagnose our real patients. So let's go in the OR. So what we're going to do now is I'm going to pass it off to Dr. Barbieri, and Dr. Barbieri is going to show you something called ultrasound. So ultrasound is a technology that a lot of people have heard used only on babies, but ultrasound is something that physicians like Dr. Barbieri use to diagnose all kinds of other things. So what I'm going to do is I'm going to expose my belly, and Dr. Barbieri is going to show you a bunch of cool stuff on the ultrasound.
Yeah. So there are many different machines. This one we have here, and I know maybe it's going to be hard to see because the image is actually black and white. And what happens is we're going to use one of these. These guys here, they make some sound. It's a sound that we cannot hear. If we were superheroes, we would hear. But based on the sound they make and how fast they go forth and back, they can actually create an image, and we can pretty much see inside the body and look for different things. And we can do ultrasound of the head, of the eye, of the neck, lungs, belly, chest, pretty much everything. And it really helps out because this is sort of, we can move this around in the hospital, we can bring it to different patients, and it really, really, really helps us out. The image is a little bit too difficult to understand, so I'm going to try to show you. The heart doesn't look like a heart you guys are usually see in drawings, but I'll show you how it looks, and hopefully you can see. All right, so we're going to take a look at Amy's heart and see if it's doing okay. Excuse me. All right, let me see. All right, I don't know if you guys can see. Amy, can you take a deep breath and then let it all go? Yeah. All right. So this is actually her heart moving. You see? I know it doesn't look like in the drawings, but this is actually her heart moving. And we can actually we can try to see the direction the blood is going, and we can also try to hear it. So for example, I want to see if everything is looking great. I can do this. All right, so I hope you guys could hear that, but that's pretty much Amy's heart beating. And based on the characteristics of the sound, the images that show up here, we can try to figure out if there's anything going wrong, if everything is okay with the heart or not. And for now, everything is okay.
Good to know. All right, let me get all that goo off myself. Absolutely. So now what we're going to do is we're going to show you guys some really fun stuff. So my job in the simulation center is to work with the actors, and we call those actors standardized patients, or SPs. And so sometimes when an SP is pretending to be a patient, they need to look injured. So we're going to come over here. See people on that side?
Mm-hmm.
No, I'm going to do one. So what we're going to do is we're going to show you some of the ways that we have our patients look injured. Do you want to grab some? Yeah. If you go round and round, it goes taller and shorter. So one of the things that we need to do, something that's really simple that you guys could do at home, if you have a little bit of Vaseline or petroleum jelly, you can make a little home blister. So you need Vaseline, you need a piece of toilet paper, which hopefully everybody has some of that. I know with COVID that's a little hard to find sometimes. And then any kind of red thing. So if you have red lipstick somewhere, red eyeshadow, even a washable marker would work. And so what you want to do is you want to start, we're going to give Dr. Barbieri
That
a
light's
blister.
washing you out, Aim. That
The
light's
light
washing
is
you out.
washing you out? Okay.
Much better. There
There
you
we
go.
go. So we're going to put a little of this red on Dr. Barbieri's skin. And if you guys have ever had a blister from a burn, which I hope you have not, you know the skin gets very angry and red. So we're just going to start with that base. That's nice and pinky red. And then what we're going to do is we're going to take the Vaseline and we're going to get a blob of it. With your Vaseline at home, you can just stick your fingers right in it, but here at work, I want to keep it pretty clean. So we're going to do that. And then you take it and you just want to spin the head of that and make yourself a nice little blob. And then what you're going to do is you're going to tear a piece of the toilet paper that's just a little bit bigger than the blob. And you only want one layer. And then what you want to do is you want to lay that on top and very, very gently tap it down around. And it magically disappears as it gets wet from the Vaseline. So now you're done and you have a really disgusting homemade blister that will fool just about anybody. If you really want to get good, when you're done, you can add a little of the pink to the top. And that just adds a little icing on the cake there, makes it look extra disgusting. So that's one thing. Did you want to say something?
Nope. That's it.
Okay. So that's one thing I'll do, because why do we do that? So if you're a doctor and I tell you to walk in the room and I say, hey, this guy Pedro came in, he was at home cooking some chicken for dinner and he dropped the chicken into the boiling water and it splashed onto his hand. And now he's here with a big blister. I need you to go take care of him. So you as the doctor walk in, if you see a hand like this, it's very difficult for your brain to remember that symptom that I told you. It's very difficult for your brain to remember, hey, this guy has a big blister. But if you walk in and you see this, I think you're going to remember that that person has a blister. So that's why we do it, because every time we do a simulation here in the simulation center, we want it to be as believable as possible. So what we do is education and training. So the whole purpose of this entire large center is education and training for all the people that work here at Mayo Clinic and in the surrounding community. We've helped the Jacksonville Sheriff's Office. We've helped the fire department here in Jacksonville. We've worked with several branches of the military. So we always want to make sure that what we do here is as realistic as possible. So how are we doing on time?
It's 3:15.
It's 3:15? Okay, good.
What I would also like to point out is we try to make this as realistic as possible, but that doesn't mean you cannot have the same sort of experience in learning with other different things. So what we've done in the past as well, and I'm not from here, I'm from Brazil, and we don't have all this kind of stuff down there. And we used a few bottles of Coca-Cola in, the big bottles, and we can actually simulate like a torso and teach how to do CPR, how to resuscitate people. So that you can get creative. You don't need big stuff, big money. You can get creative and you can teach and learn a lot of things. And some of the things we're showing you here, you guys already probably have all these on your house,
Yep. Charmander, I see you're raising your hand. Let's see, what does Charmander have to say? Charmander, what would you like to ask? Do you want to ask the question? I don't see
it. I accidentally clicked it and it popped up.
Okay. Cool name though. I saw we had Pikachu on the call as well.
Thanks.
And apparently Pikachu is hiding.
Oh no, no hiding, Pikachu.
Pikachu, get up here right now!
We choose you, Pikachu. All right, back to the demonstration. So next we're going to show you, the nice thing about moulage is we can heal people really quickly. It's not like real medicine where it's difficult. We just wipe it right off. So the next thing we're going to show you is a bruise. So bruises will matter, or bruises, how you make a bruise. This is how I start. This is actually called a bruise wheel from a specific type of makeup. And you can find these online, but you do not have to have a fancy bruise wheel. If you can just find these colors of makeup around your house, you can use those. So one thing you always have to look at is what is the color of the person's skin that you're making the wound on. So if you have someone with light skin like Dr. Barbieri, if you have someone with dark skin, you have to pay attention to that because that will matter what colors you choose. If you have someone with darker skin, you are not going to use this green and this yellow because a bruise on that color skin would not really show green or yellow in real life. Dr. Barbieri's skin is light, so we can show that green and yellow. So we're going to pretend that he was rescuing a puppy and he fell down and he hit his knuckles on a fence while he was trying to pull that puppy out from under the fence. So he is going to start with some dark colors here where he injured himself the most. If anybody's ever had a bruise, or if you have a bruise right now, take a look at it and really look at what colors are included in that bruise. And like I said, it will matter what color skin you have on how much these different colors show up. So we're going to say that Dr. Barbieri did this about a week ago. So we're going to start to see some of these colors of healing on his bruise. And the one thing you don't want to do is you don't want to take all these colors and put them in the same spot. Because we all learned in kindergarten, if you put all the colors in the same spot, you get a color that looks like brown.
Or just ridiculous, or black with a small tint of brown.
That's right.
Yeah.
It's not a pretty color, whatever it turns out to be.
Yeah, mostly I've done that before with food coloring, and it always ends up being black.
Yep. So what we're gonna do here is we're just blending it all together, just smushing it all together. And then we can add more colors where we need them. So I want a little more green there.
Hey, Pikachu. Pikachu's back.
Oh, good. We missed Pikachu. All right. So now we have a good bruise on Dr. Barbieri's hand. So again, the whole point of it is to make it realistic. If we told you Dr. Barbieri hit a fence with his hand, injuring himself, creating a large bruise about a week ago, that's easy for your brain to remember if your brain can see it. But then let's add to that story. What if when he hit the fence, he scraped his hand? So we have this very cool tool. It's a really hard, scratchy sponge called a stipple sponge.
You have to make it like, you have to make the colors stream down.
And then here we go. We scrape, 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 and scrape. And so the hard bristles of this create those nice scratches and scrapes on Dr. Barbieri's hand. And those can also be used for spatter. So little drops of things. If he got splashed with something, that can create that spatter effect. So this is a really cool tool that I use to make our realistic makeup here in the Sim Center. And then if we want to go one step further and get really advanced, we dip into the nose and scar wax. So if you've ever seen a movie where somebody had a really funny shaped nose or a wart on their face or weird shaped ears, it may have been scar wax. And this comes in a bunch of different colors. So if this color does not match your skin, that is not a problem. You can cover it up with foundation to match your skin, or you can just get a different color base. So what we're gonna do, because it's wax, and wax gets soft when you warm it up, just took a little bowl, and I'm warming it up in my hand. And we're gonna say Dr. Barbieri was having a bagel this morning, and somebody was distracting him while he was cutting that bagel. He cut his finger.
Am I correct? You're probably gonna add a quick dash of red.
So we're gonna chop down the center and create that scrape, or that slice. So right now, that doesn't look very realistic. It just looks like a big gash. So if Dr. Barbieri squeezes his finger,
Man, this is not his month.
this is certainly not his month. Poor guy, he can't catch a break. So now what we're gonna do is we're gonna take some colors and we're gonna get into that wound and give it some depth. So as you guys watch me do these colors, one of the cool things about working at Mayo Clinic is that no matter what you want to do, you can work at a healthcare facility. So if you want to be a chef, we have a 3-star chef who makes our food here at Mayo Clinic. If you want to be a photographer, if you want to be, obviously, if you want to be a doctor or a nurse, you can work at Mayo Clinic, but all kinds of different people make Mayo Clinic work. So always think about healthcare when you think about future careers, because there's so many things that you can do in the healthcare field. And let me tell you, healthcare is never going away. Unfortunately, we are always going to have sick people. But that means that you always have a job. So that's good stuff. So what I'm doing is I'm just taking some different colors and I'm working up the sides of Dr. Barbieri's wound that we created here. Now we're getting somewhere. I hope nobody gets grossed out by this.
Was that wound I was thinking about before?
So this is a nice fake wound on Dr. Barbieri. And then if we really wanted to sell it, we would add some simulated blood. We would add some simulated blood to run through it. So do you guys think you can handle the blood? Just a couple drops of it? I think you can.
More than a couple drops.
How would you recreate a burn?
A burn
you
mark?
recreate a burn?
A
burn
burn.
mark?
Burns are actually fairly easy to recreate. So now you can see, now Dr. Barbieri has a fresh wound with some blood on it, and he really, really needs some medical help.
Yeah.
Thankfully, he's an emergency physician, so he can help himself.
That looks really good.
That looks good. Good stuff. So a burn, we had a good question about a burn. So a burn is fairly easy. You just want to do all the reds and pinks. And again, this really, really matters what skin tone you have. So it's not about race. It's all about just actual colors in your skin. So Amy and Dr. Barbieri and I would all be considered Caucasian, but if you look at us all together, we all have I got a good tan going on. Hey. We all have very different colors in our skin. Mine is very yellow. Amy's has a lot of pink underneath it, and Dr. Barbieri's is just hairy. So, so it all depends on what you want to look. So on skin like mine, doing a burn would be pretty easy. So you just want to make your base very red and pink. And again, just like with the bruise, you want to try and put colors in different places. Because if you look closely at your hand, if you have very lighter skin, you can see some of the greens of your veins. You can see that your knuckles are probably a different color than the rest of your skin. So there's all kinds of variation in your skin that you don't always notice until you really start to look. So then once it's pink, all you have to do is take a little bit of that Vaseline that we used earlier and just rub a very thin layer of Vaseline. And now all of a sudden, it looks like I have a pretty disgusting burn. Now, if you wanted to go to the next level, if you have some Elmer's glue at home, you can put a very thin layer of Elmer's glue over that, if you're patient enough to let it wait and dry. And then if you pick up parts of it, it looks like burnt skin that has all kinds of, Amy is grossed out behind the camera, shaking her head. How are we doing on time?
We're at 3:28.
3:28, okay. Well, I hope you guys enjoyed it. Dr. Barbieri, anything
Yeah,
final?
no, I hope
Now that
you-
I've completely beat up your hand?
I want to get a picture of that.
yeah, I hope you guys enjoyed it. Yeah, that's it.
Does anyone have any final questions about Mayo Clinic or about what we do here at the Simulation Center?
I'm watching.
During the simulations, can you actually control what diseases the bunny?
What
you know
diseases they
what I
have?
mean.
Yeah, I know what you're saying.
Yeah, we absolutely can. So Dr. Barbieri is our physician. I am the standardized patient coordinator. So if I hire an actor and I want them to have a breathing condition, maybe COPD, chronic obstructive pulmonary disorder, I ask Dr. Barbieri a bunch of questions to understand what that looks like. And then I teach my actor that, okay, you're gonna be like this and you're gonna breathe like this. And when the doctor comes in, they see those correct symptoms and they're able to diagnose. So anything that's too advanced for a person to do, we have the high-tech mannequins in the room. Anybody else?
Not really. I got nothing.
All right, thank you guys so much for letting us.
Charmander does.
Oh, Charmander, go for it.
So, could you simulate the coronavirus?
We actually can. That's a very, very good question. So we have a lot of information from physicians like Dr. Barbieri. Dr. Barbieri has treated a lot of real COVID patients in Brazil. Do you want to speak to that?
Yeah, I mean, I'm not going to get into the details of it, but Brazil got hit really hard with the coronavirus. And we, as an emergency physician, I also work in the ICU in the emergency department, so I got to see a lot of patients with COVID. And what happened is because of how the virus is transmitted from person to person, we had to adapt and change a few protocols. And that before we put that into place, we actually trained in the simulation center without real patients, with patients, without real COVID patients, so we're not at risk. And then after we see that that works in the simulation, we bring that to our practice. So yes, we did practice a lot of things, and we are still doing it because we are always coming up with new ideas. So we are actually working on a couple projects already to come up with new ideas and ways to make the patients better and the healthcare providers safer.
Great question. Thank you for that.
Thanks.
So thank you so much, and a big round of applause to all the healthcare workers at this time. So thank you so much for your dedicated service, and thank you so much for giving a virtual tour for Shiva students. Yeah.
You're welcome. You guys stay safe and wear your masks. Cover your noses.
Stay home.
Stay home.
All right. Bye.
Bye.
Wait,
What?
to Shiva, to Robotics County, what are we going to be doing? What are we going to be doing tomorrow? Or what are we going to be doing next time?
Oh yeah, I'll send the agenda. Okay, surprise, but more exciting thing. I'll see you all tomorrow.
All right.
Yeah.
Logging out right